Well, thank you everybody for being here. So I'm Alex.
I'm Elisa.
And I'm Jake.
And we're Team Outpatience, focused on the patient and also focused on how it takes patients to get through therapy recovery.
Imagine you just got out of carpal tunnel surgery and you're in the room with your therapy professional.
They just got done debriefing you and you're swamped with stacks of paper. You have no idea what to do.
Paper instructions are hard to follow. Even when patients are shown how to do their therapy exercises, they have a hard time remembering what they need to do and how they need to do it.
So Outpatience plans to bridge this communication gap with our digital healthcare platform. It seamlessly integrates the patient's tailored therapy plan into their life.
First, the patient works with the therapist to learn their track. When they're doing the exercises, the patient is recording them to learn the proper way how to do them on their own phone.
And after a few preference questions, it's put straight into their phone.
From there, the app schedules their treatment, and when it comes time for therapy, they get a personalized notification. Each notification shows their exact track actions and how they need to perform these exercises on their own personalized videos.
So the therapy market itself is a $29 billion care industry, and it's estimated about half the patients in that industry don't follow their therapy.
Outpatients represents an opportunity for employers to save on employee health care.
When employees don't recover as quick or they don't really recover as well as they should, it costs employers a lot in productivity, and it also costs them the extra care.
Large healthcare providers like hospitals and large rehabilitation centers, they rely on efficient quality care to maintain their reputation and keep their costs low.
And this is what we believe will be our first customer, these big organizations, these big employers.
And we plan to help these providers by getting their patients and their employees back to normal life quickly and in good health.
So in the future, we're going to offer this platform in a tiered program. So it's going to be based on the quantity of patients, and every extra patient beyond that quantity is an extra charge.
We would love to meet with anyone that has advice for us or just likes our product. You can reach us at outpatient.care@gmail.com or just talk to us after what I think. Thank you.
Thank you.
Is this a tool that basically reminds the patient what exercises they have to perform, or is this a way to communicate with a specialist?
It's a tool,
Yeah.
so it's additive to what you're already getting. So it's not meant to replace what the therapy gives you. It's meant to make it easier for you to follow it and easier for you to remind you of what it is.
The first part is enforcing the therapy and the plan of the therapy. The communication platform, we might do that. We're thinking about it.
What do you do with, I know, it's a great idea. What do you do with senior citizens or folks over 70 due to age or maybe don't have smartphones?
So it's also a website. So there are two ways to do this. You can
They
do
don't
it
have
with
a
an
laptop,
app.
and they don't have
They
a
don't
laptop.
need the app. So it's all on internet platforms. So we make a website for them. It's personalized. So when they go home, they go on their own specific, that's tailored for them website. And their videos pop up and their instructions, and they just can go from there.
Or it can be done by a caregiver, so the caregiver can also get the app for them, which makes it much easier. And to point on that as well, we're actually focusing on entering the market on upper extremity orthopedics, so like the hand and the shoulder. So that we want to focus on that main pain point first and then expand to other groups.
Are you anticipating as part of this making the videos themselves so that it'll be customized to your app?
Some of them.
Yeah.
A subset of exercises are standardized for almost every shoulder surgery, but some of them are not, and that's why we offer the chance to record them on your phone, and there will be a subset of those videos we'll produce ourselves. Yes.
Yeah, so for some surgical procedures, so based on the hand, there might be 10 different surgical procedures per physician, and so every physician has a very specific way to do it. So that's why we're going to give the option of the standardized plus the personalized. And we already know that some therapists are actually already making those videos themselves.
So there is a library, and you can just drag the ones you want as a therapist. And if you can't find the specific one you want, you just click an X at the bottom, and you can make your own.
So you had the providers paying for this product, is that correct?
Yes.
That's
Yeah.
one of our ideas, yes. We're also considering a few other models as well.
And is there a current reimbursement codes for outpatient therapy, or would this be something that you'd pitch to providers in terms of, bundled care and accountable
Yeah,
care?
so we're looking into that. We have started, so bundle care. We're actually looking into looking at the codes and different ways that they're charged. And it's going to have to be, they're trying to educate us right now. We're trying to educate on the insurance system to understand it.
Codes, I presume,
Yeah.
Yeah.
We understand that system. We're trying to find our part of that.
Okay, good. Yeah, I'd encourage you to do that because that would be key here in terms
Yeah.
of getting paid. Yeah.
Thanks, everybody.
Thank you.